Welcome back to the Hand to Shoulder Solution, giving pain the middle finger. I'm your host, Carl Petitto. I'm an occupational therapist and a board-certified hand therapist. I specialize in the rehabilitation of orthopedic conditions affecting the hand through the shoulder, more accurately, the fingertips through the shoulder. I deal with everything from the bones to the ligaments which connect bone to bone, tendons which connect muscles to bone, the muscles themselves work with as well. The nerves, which send signals from the brain to the muscles to contract, which controls our movements, and also sends signals from the skin and the muscles and the bones to our brains, so we know where our hand is in space. That's proprioception. So there's very interesting feedback loop that follows the nerves or the wiring system of the body. Also the skin, treating wounds, optimizing scar tissue, so scars form nice and flat and not noticeable. Scars can also become very sensitive. We work to desensitize scars. So it's a lot. And I started this podcast because I want the public to understand the fundamentals of how your body works and recognize what your body needs so you can obtain what you need when you need it. In healthcare in general, the service that you obtain and the timing when you receive it is very important for a good outcome. What this is not, it is not treatment or advice. This is information sharing so that you may be empowered to make decisions for yourself in accordance with your healthcare provider. So it's very important to, you're the most important part of the team, whether you're working with your surgeon, your physician, your physician assistant, your therapist, or you're talking to the nurse. You're the most important part of the team, and you're reporting what is going on with you. What has, when did the condition start? What is the condition? How much does it hurt? When does it hurt? What kind of things bother it? You can be thought of like an investigation to figure out, okay, what's the source of the problem? And as clinicians, we're thinking, what kind of tests do we need to do, whether it be an on the spot, clinical, orthopedic test, or if it's something that needs some more advanced level testing. I try to stay up on things. Working with my colleagues, I work in an orthopedic office with surgeons, also a board-certified hand surgeon who's an orthopedic surgeon, went on to further training to be a hand specialist, hand and wrist. Also, I attend an annual meeting of the Hand Rehabilitation Foundation Surgery and Rehab of the Hand and Upper Extremity, and also annual meeting held by American Society for Surgery of the Hand, where it's presented the most up-to-date surgical and therapeutic techniques for quicker recovery, better outcome. We're always trying to improve, and that's one thing I like about healthcare. We're always trying to improve. We're always trying to do things better for the patient, and we practice evidence-based practice. So the evidence is, what are the research studies showing us? Okay, we've been doing something a certain way for years. The evidence shows now maybe we need to do it a little bit differently. So now what I want to talk about today is, what are people doing at home to try to help relieve their symptoms? However, without realizing it, they're making things worse. So sometimes what a person doesn't do is more important than what they do. So, as with most things, if you're doing something that is, not appropriate and perhaps making the condition worse, then, it's easy to get stuck in a rut where you're just saying, this isn't helping, but, I'm going to do it. I'm going to do it more. And that's one example is to quote unquote, keep it moving. Our bodies are designed to move. So naturally we want to keep our joints free, our joints moving. And whether it's, stiffness from coming out of a cast, or stiffness from having arthritis, or stiffness from having tendonitis, inflamed tendon, or it's stiffness from having a muscle that's too tight, that's limiting motion and having a tethering effect on the tendon, which connects the muscle to the bone, where it's a natural state for us to want to, if we can just move it, let's keep it moving. It's got to get better. But usually that is not the case. And movement is important, but the right movement is important, and the right amount of movement is important. So let's take, for example, arthritis, or any joint stiffness. Because it's stiff and tight, we're going to want to force it to move and get it going. But doing too much is very easy to overdose on that. So doing too much will increase inflammation, and then that'll stimulate us to want to move even more, because now it's more inflamed and it's tighter. But the trapping is that when you're moving it, it feels nice and loose. It feels like, wow, okay, it's doing better. Then 5 or 10 minutes later, now it feels a little bit worse, and a person naturally remembers, it felt great when I was moving it, so let's go back to let's do more of it. Also, rubbing and massaging it. Something that's interesting is when you hit your shin on the coffee table, or bump your elbow or something, you want to reach over and give it deep pressure, or rub your shin after you hit it on the coffee table. Deep pressure releases chemicals within the cells to slow the pain response to the brain. So when our wrist, let's say we took a fall and fell on an outstretched hand, and now it's just really sore, it's swollen, and a few weeks has gone by, and now the person is just kind of rubbing it, just trying to get it to feel better. And a lot of times when the person is rubbing it, again, that's releasing some chemicals to slow the pain response to the brain, so it has a little soothing action. But the after effect is now it's been aggravated, it's been irritated, because it's just had that external pressure on it, and it starts to become a habit, and people will do it all day. I'll have patients come in to their initial visit, and they're sitting there and they're rubbing their wrist, they're rubbing their fingers, they're rubbing their hand, and say, how often do you do that? So, whenever I think of it, is usually the answer. Whenever I think of it. So then we talk about that and the drawbacks of doing it and why that habit should stop. Also, what always feels good on the joints and the tissues is heat. So, I have a lot of patients who like to live in the heating pad, and they put that on, and they'll put it on medium or high. A lot of people will put it on high and just keep it on there for about, a half hour or longer while they're watching TV, and it'll feel really soothing while it's on. But the after effect, same thing, increased inflammation, and now the pain is worse. And then they'll remember it felt great with the heat on, so let's go back to the heat. And it's just really this vicious cycle. Now, cold, wrong timing, techniques, placement, it really depends on the part of the body. So let's take the carpal tunnel. If a person is having a lot of aching in their wrist, and they're having, that heel of the palm right here in this carpal tunnel area, people will lay an ice pack on there. And what the carpal tunnel does not like is any pressure, because the nerve that we talked about in a previous episode is about as wide as a pen or pencil and thick like a noodle. And that is really shallow or superficial, is right underneath the skin and right underneath the ligament that forms the roof of the carpal tunnel. So the cold will reduce the swelling, it will reduce the inflammation, but now you have the physical pressure of the cold pack. So those patients, they say, instead of a cold pack, which by the way doesn't really get that deeply cold anyway, because by the time you wrap around the towel around the cold pack and then you lay it on there, I used to have patients just use a pillowcase over the cold pack, but also never use it over the carpal tunnel. What I really like is cold running water, only until it's deeply cold, 10 to 20 seconds. And that envelops the whole thing. It whisks away the internal inflammation much more effectively, because it's new coldness going over it all the time, washing over it. And 10 to 20 seconds, right when that's deeply cold, you're done. And studies have shown that that's more effective than an ice pack for 20 minutes, or 10 minutes rather. Basically on any part of the body, the cold running water is more effective. Or direct icing. Using an ice cube, 10 to 20 seconds, directly on the skin, gliding it over very lightly, just barely touching the skin surface. And when that's deeply cold, 10 or 20 seconds, it's done. And then again, it's more effective than a cold pack for 10 minutes. You have to have the correct timing, technique, and correct placement. Fingers, patients jam their fingers. I see a lot of finger fractures, and we have to get those moving early. If it's a non-displaced fracture and it doesn't need pins or screws, either way, we get them moving within about 4 days or so, nice and gently. If the fracture is displaced, meaning it has to be lined up again, or if there's multiple fragments, which is called a comminuted fracture, the surgeon will have to go in and use what's called K-wire pins to align the bones and literally pin the bones in place, and then put you've probably seen a little yellow ball on the end of the pin. That's just for safety, so the person doesn't poke their eye with it. Even that, the joints that remain free after that fracture pinning, we start moving those because the fingers are terribly unforgiving. They stiffen up very, very rapidly. So we start moving those with very specific techniques, safe techniques. We want to reduce pain and inflammation. So when enough healing has occurred, probably after a week or a couple of weeks, we still have them, walk in an elevated position, sit in an elevated position, but also even just taking a glass of water out of the refrigerator, sticking the patient's finger in it until it's deeply cold, 10 or 20 or 25 seconds, really reduces that inflammation very, very nicely. And there's no weight or there's no pressure on it at all with the use of the cold water or an ice cube gliding over the surface. In the clinic, I have some nice cryo cups. So buy them on Amazon. I'll put a link below. The cryo cup I can fill it up with water, then take the bottom off. Then I got a nice plastic handle, and I have the ice block that I can glide on a wrist or a finger or the back of the hand, etc. Here's something that, I wish I knew when I was a kid, even just to start using so I want to misuse my thumb because I'm having arthritis symptoms at the base of my thumb, at the thumb basilar joint or first CMC joint. The thumb is out there in life, and we tend to use it for everything. Let me start with explaining that the thumb side of the hand is designed for buttons, safety pins, nuts and bolts, getting us started, fine motor activities, small activities that don't require a lot of force. The small finger side of the hand is the power side of the grip. This is all power over here. And you want to think so. It's sort of counterintuitive because, well, how can the little finger be the most powerful? It's the little finger and the ring finger. That's your power grip. Over here is designed for more, small, fine motor activities. So let's take the cap of a water bottle. What do most people do? What do I used to do is really pinch that hard with my thumb and pull that hard cap off. It seems like nowadays they are just on there really, really tight. Either I'm getting weaker or these are made differently. One thing is, it's a good thing, it's less plastic. The cap is actually thinner. It's not as tall, so you don't get enough purchase on the cap when you're taking it off. So you have to do a lot of force. So because of moment arm of force is the effects of leverage. So if your thumb is about 5 inches long and you're putting about 20 pounds of force on that, because of the laws of leverage, when you get down to the base of the thumb, now you have 5 times 20 is 100. So you have 100 inch-pounds of force on that tiny little joint. But now watch this. If I were to hold it, the bottle with my hand, and then use, lefty-loosey, because I'm going to turn it to the left, and use for whatever reason, I like using my ring finger. It just feels comfortable to me. I get that ring finger right on there. Now I got a clamp on that. I could really grip that hard and just take it off easily. And that comes right off nicely. And then if I want to tighten down something real hard, righty-tighty. So righty-tighty, lefty-loosey. And then I could clamp around that and just tighten that down hard. If I'm working on something in my garage and something's hard to turn and I'm a little too lazy to go grab the wrench and I want to just get onto that with my hand, I'm not going to use my thumb and index finger. I'm going to use the small finger side of my hand and see if I can just get us started in taking it off. Then if that doesn't work, I go get the wrench. That really makes all the difference. So when patients come in and they're having a lot of arthritis and affecting the base of their thumb or any other joint of their thumb, we start talking about their ergonomics, their ergonomic considerations of, just use your hand a little bit differently. Now, what a lot of people want to do to increase their strength in the movement is they'll grab a ball and squeeze a ball. And it's natural to want to squeeze a ball because if you look at the hand, it's sort of, when you make little half a fist, it kind of is a spherical shape. And then the palm is sort of cupped. So people will just feel that, wow, it feels good to squeeze a ball. But what that does is tightens up the muscles between these bones in your hand. They're called the intrinsic muscles, and it makes your hand a little more cupped, and it tightens up this. You see the thick, heavy ligament on the palm there. That gets tighter, and then that affects several other structures within the hand. And when patients come in, I'll take their hand, I'll just open up that palm, and I'll just stretch that palm out, and it feels really, really good. So there's two transverse palmar arches. There's a distal, which is further away from the body, proximal, closer to the body, palmar arch, and then there's a longitudinal. So there's an arch like this, two arches like this, and I'll open up all of them and just stretch that out, and then I'll stretch the intrinsic muscles, which live between these bones within the hand, and that just really frees up things nicely. So if you shouldn't use a ball, then what should you use? What's ideal is something like this, hand grip strengthener. We just give these out in the clinic, and I'll set it up for people, and put the appropriate amount of tension. But we use something like this. Also, even the hand grip strengthener with the sort of V shape, and it has the coil on the top for giving resistance, but just not the ball. And you shouldn't overdo it either. A person goes to the gym and strengthens one muscle group, one part of the body 3 times a week, or so, not several times a day. So where people go wrong is they'll just keep this in a handy position. They just squeeze it whenever they think about it. They just go through a lot of these and squeeze it. When they're all done squeezing, they squeeze it some more. And that just naturally, just really aggravates the symptoms, increases inflammation. Also, strengthening too early. There's, I've seen a lot of situations where the patient had, a severe injury, or they had a surgery, and now, whatever they're doing isn't working. So now they come to my clinic, and my first question is, what have you been doing for it? How's it been working? Oh, you are strengthening. When did you start strengthening? Okay, well, it's soon. It's soon to start strengthening. Let's just let it rest for a few days. Don't do anything. Let it calm down. Why don't you see me the first part of next week? And they come in, and guess what? Now their pain went from an 8 down to a 1 out of 10. Now the pain went from severe to very slight. Okay, now let's work on range of motion. Let's restore your movement. And then now later, when there's better healing has occurred, now we can start to strengthen, but very specific types of strengthening with other tools, but isometric perhaps, where you're just holding it until the muscles get a little bit tired instead of doing repetitions. That's one example. Also, wrong type of strengthening. There's a lot of techniques out there. Something real quick about the shoulder. I see people doing military press, also cleans. So here's an orthopedic test for one muscle, the rotator cuff, that's most commonly torn, supraspinatus. So if you hold a can, we call this empty can test. If you were to turn it like you're emptying the can, now that puts maximal stress on the supraspinatus tendon, which is one of the muscles of the rotator cuff. And then we add light resistance. And if that is very significantly painful, there's a chance they might have a rotator cuff tear. So I see weightlifters, and I used to do this. I would get a heavy barbell, I'd do cleans, I'd pull this up. So what position am I in now? If I straighten my elbow, I'm in empty can position. And that is just really focusing on that one tiny little muscle, the rotator cuff, that's most commonly torn, and then also gets commonly torn due to wear and tear. I don't want to do the exercise for strengthening. I want to do something that would be, safe. And one thing which works the front of the shoulder and the side of the shoulder, the anterior deltoid and the lateral deltoid, is Arnold press. So if I have, I'm going to use a muscle instead of a dumbbell. I meant to bring a dumbbell with me. So if you hold the dumbbell, and the dumbbell, your palm is facing your shoulder, and you push it straight up, and now the palm is facing away from facing front, and now your palm is facing the rear, and press it up, now the palm is facing front again. That safely works anterior and lateral deltoid, and I'm not tearing up my rotator cuff. Out here, this puts a lot of pressure on the doing a military press, especially behind the neck, that puts a lot of pressure in the area of where the proximal humerus, that is really the ball of the ball and socket, and that sits under a roof of bone that is part of the shoulder blade. Look what I found. I found a shoulder blade. So this is the right side, and this is the shoulder blade in the back. This is called the acromion. So this space right here is where a couple of the rotator cuff tendons travel underneath this space. So now if you're pressing up to the side like this, and you're jamming and putting a lot of pressure on those tendons, that's really going to cause some problems in that area. We're going to be talking about the shoulder in a future episode, a couple of future episodes, and talking about the basic mechanics and what goes wrong on the shoulder and really how to avoid that. So keep an eye out for that one. When people get up in the morning, especially people with arthritis or really any condition, let's say it's an injury, and we use our hands for almost everything. So we get up in the morning and start getting around and start using our hands, and it'll feel really tight, even the elbow things. And our natural instinct is, we got to get it moving. Let's just get it moving. Let's force it. Let's move it. Now, forcing that and getting it moving first thing and really just shoving it around. Remember, this is living tissue. This isn't a squeaky door hinge that we want to force that hinge and work it back and forth. And now we're going to loosen up that rusty door hinge. The rusty door hinge is not living tissue. It's not reactive tissue. This living tissue in our body is going to react. It's going to rebel. Tendons that are, really tight. Again, tendons connect muscles to bone. And by the way, if you stretch too hard, it'll cause a stretch reflex where the cells in the tendon will actually contract and try to protect itself, and therefore it tightens up. It has the opposite effect of lengthening tissues. So that's another consideration. This is another reason why you don't want to get up in the morning and just force it to get started moving. So what should you do? You should get up and just start using your hands normally and let it wake up gently on its own. Typically with most conditions, the inflammation is going to be at its lowest point in the morning because they've been resting all night, not moving. That's why it's stiff, because it's been basically in one position all night, most of the night. And then you go to start moving and it's tight. It's okay that it's tight. It's going to loosen up. Because inflammation is at its lowest point in the morning because I've been resting all night, that's a good time to use a low heating pad for 10 or 15 minutes. Not more than that. You don't want to overdose on heat, because again, the after effect is going to be increased inflammation. But low heating pad, 10 or 15 minutes in the morning, that gets things going, increases blood flow, loosens up tissues without having the effect of exacerbating inflammation, because that's the time of day when your inflammation is at its lowest point. Wrong ergonomics. We talked about ergonomics, about the water bottle cap earlier. Using our thumbs properly, using the small finger side of the hand for the power, taking off a bottle cap. And, I have people, older people, they come in and they have a lot of severe arthritis. They say, I can't do this bottle caps, everything's hard. I say, well, here, try this. I keep a bottle in the office. Try this. I say, oh, that works so much better. So, also, stirring. Also meant to bring a spoon. Did I bring anything? I brought a lot of stuff. It's nothing that I really need. I tell you what we really have in here is lights. These lights, I feel like I'm being roasted like a Thanksgiving turkey. I should put olive oil on my face. I mean, let's take a short break. Okay, break's over. No, it's not. That is not a 40-ounce Heineken. It's a bottle of water. All right, just so you know, I'm gonna have a lot of people writing in. Look at this guy drinking a 40-ounce, talking about healthcare. All right, so ergonomics. So let's say you stir something, or you're stirring a thick batter or something. And look at how that torques the wrist. But watch this. If I stop using these tiny little bones, and these tiny little ligaments, and I go like this, I just change my grip, and now I'm using bigger joints. I'm using the elbow, I'm using the shoulder, I'm using bigger muscles. I can turn that bowl and fold that brownie batter real nice, or the cheesecake mixture. Boy, do I love good fudgy brownies. My goodness. I mean, what's better than that? You make a double batch in a 9x9 pan, so they're thick. Cheesecake, I like it dense. You know, a lot of these chefs and the bakers, they say, oh, you got to put the water bath so you don't want to get a crack in your cheesecake. I like it. I like it dried out a little bit. You got that crack in the cheesecake. And don't get me started on regatta pie. I could talk about this stuff for hours, but let's stay on topic. So you're stirring, you're turning the bowl, and you're folding that mixture, and now you're using your bigger muscles and bigger bones, bigger everything to do the job, and you're not tearing up the heck out of your wrist and hand. All right. So that's some ergonomics. Another thing too is the wrist rest in front of the keyboard. They're okay if, let's say if there's a wrist back, a resting area back here, and you can put that wrist rest under the muscles of your forearm, but the wrist rest, that's part of the keyboard, that puts pressure on the carpal tunnel. So let me ask you this, if carpal tunnel syndrome is a nerve compression syndrome, why do I want compression on my nerve? So I get passionate about this because let's boil this down to the basic mechanics. The nerve that goes through the carpal tunnel, it innervates or plugs into the thumb, index, long finger, half the ring finger, and pressure is being applied on the nerve. We talked about this in a previous episode. I'll talk about it some more in future episodes, but it's a nerve compression problem, and the therapy is designed to reduce pressure on the nerve. The surgery is designed to remove pressure from the nerve. Now, if somebody's having achiness and numbness and tingling and they're having symptoms of carpal tunnel syndrome, that wrist pad should not be used, because now with the tendons, when you're typing and the tendons are moving through the carpal tunnel, that increases friction, doesn't it? So that friction will cause the tendons to swell up a little bit and occupy more space in the tunnel and put pressure on the nerve. And just the pressure itself, the nerve is pretty shallow or superficial on the carpal tunnel. So, you don't want any pressure on that. Ideally, that's another thing I meant to bring as a keyboard, and as long as I'm going to get that for the next episode, we'll bring some brownies and cheesecake too. So bring the keyboard to the edge of the desk, and then you could be typing with the wrist pretty straight, the upright. I'm talking about ergonomics. I'm sitting here slouching. So you sit up nice and straight. You're in a comfortable position. The shoulders aren't hiked up. You're here. You're typing. The wrists are straight. There's nothing but air on the carpal tunnel, heel of the palm. Okay, nothing but air here. And then, ideally, if you've got a little clipboard thing that stands up vertically, you put the papers there. Or what I usually see is folks will put their paperwork right in front of them, and then put the keyboard out here, and then be in a rounded position, the neck is all cranked, and then they're looking down here at the papers, and they're way out here trying to type, end up with the shoulder problems. But watch this. Watch my posture. Bring the keyboard back. Now I'm in a more natural posture. I'm sitting the way my body was designed to sit. So that is just some information, some basics on, what not to do, what to do, the why. Again, it goes back to the why. Like, we're told to, sit up straight, but why? We're told to, don't do this or don't do that, but why? And I think if we understand, for me, when I understand why, it helps me to understand it fully in the first place, and it helps me to remember. You remember the good habits, and frankly, it just helps me to create good habits. So, all my videos, I'll be putting some links to some things that are helpful. That it will bring you right to Amazon, and you'll be able to order for yourself. I want to make things convenient. Also, write in with questions. I want to come into the studio with some questions, and then answer those questions, and then those spur other topics. So please write in. Thanks a lot for listening and watching. I'll see you next time. Yeah, bye-bye.